This is an overview of the Cloud4Health eHealth platform. And what's our vision? Well, we aim to provide a new information architecture for health and social care, and hopefully in some way change the world that we live in. So why? Well, things are changing and we're moving towards an information age, and the healthcare systems that we've created are typically legacy. We aim to create a distributed patient care system that's much more holistic, focused around the patient, is preemptive in terms of health and social care, and it allows the patient and the citizen to take more control of their health. So our aim is to really try and integrate each of the domains that someone might exist within assisted living, primary and secondary healthcare, and with the social care, and really to understand how data can flow between them and how we can translate rights and identity. Some of the key factors behind this is that we have an ageing population. There is generally a lack of information sharing across the different domains. There's actually a strong demand to consume healthcare data, and really there is very little integration with carers and trusted people within inside our current systems. What is it? Well, really, it tries to define digital and human trust. It has strong identity provision, which we can assign rights, and then on the other side it has strong governance over the overall scalable infrastructure from a micro to macro level, and then has useful clinical services which clinicians can start to see benefit in. And our focus is really on the translation of rights and identities between the different domains. So what we try to do is we try to create a dynamic patient care record which allows any type of clinical or social health view, and underpinning this is a strong security policy. We split the system into different areas, the capture, the storage within data buckets, and then the only output from the system is in well-managed, trusted services. These are clinical portals. We have a standard cloud infrastructure where we go to a single point of contact for our service. We provide an identity, and then based on that we will get certain rights to a clinical service which is created in the cloud for us dynamically. What benefits does it have? Well, we've made sure that we make both a business benefit and also a clinical benefit. So we have been identifying key clinical services which we can use and then enable them in an IT infrastructure and lock down with a strong governance policy. For this we've taken things like the early warning score system and automated it so that clinicians can get access to early warning risk scores through mobile devices, web interfaces and so on. A key factor will be if it can scale up across a large-scale healthcare and social care infrastructure. And we think so because we have created a security infrastructure which involves primary and secondary healthcare with formalised role-based security based on a very strong ontology, and then we have the patient being able to control their own environment through a circle of trust, such as through Microsoft Health Vault. We've built a complete virtualized infrastructure, but at the top level we have evidence-based medicine, personal health records and so on, all on top of a cloud infrastructure. And then we have different interfaces to the architecture that we've created, and especially the patient themselves have the rights to be able to change their own policies and to find their circle of trust. Everything is built on a domain ontology which really abstracts the whole health and social care infrastructure. So what is the future? Well, really we aim to create a complete social and healthcare ecosystem where we have formalised systems and also new consumer e-health infrastructures such as the e-book and so on. And Cloud4Health will provide the main security infrastructure and also allow for external links to other domains such as education, law enforcement, social care and so on. And that's Cloud4Health.